thank you, Dr. Jaffe, and the organizers of the conference for inviting me. The conference program that you're participating in is extraordinary. It is among the most important, I think, conferences and discussions that is happening to deal with the issues of risk assessment, safety planning, and mitigating and managing risk is a crucial issue around community safety and safety primarily for women and children. So I give full credit to the organizers, the participants, and the presenters. Certainly we're at a stage where there's a variety of tools that are being used to assess risk by sometimes multidisciplinary teams, often largely the police. These tools are extremely valuable and important. In some ways, they are still in the stage of being tested, if you like. And speaking certainly from my experience as a judge and as a lawyer, these are often required to be proven in a court before they're fully accepted. So good academic consideration and evaluation and collaboration is crucial to make sure that we have good tools, that they work and that they're effective. There's those issues. But in my role as a child advocate, what is crucial to me is that we have good safety. And these tools are crucial for safety, crucial to identify cases that are higher risk and factors where we need to take a much more collaborative and effective approach. So I'm delighted that I was invited to talk about the report of my office into the deaths of the Schoenborn children, and I'm going to share some of our findings and insights from that report. And although this report was issued earlier this year, in March of this year, it is not a report that we issue and we ignore. In fact, earlier this week, I was speaking and engaged with a select standing committee on children and youth in our BC Legislative Assembly, where members of the government side and the opposition sit together and we talk about primary issues of concern for children and families. And we actually debriefed on this report, and we had the representatives of the government of British Columbia, including representatives of an important new office, a provincial office for domestic violence, attend to talk about how they are responding to the recommendations and whether we are making progress. And so I just say that because it's important that a report isn't there to exploit victims and families. A report is there to find out more about what happened. Could more have been done to prevent death and injury in domestic violence homicides? And what are the lessons we must learn from them? And once we find some lessons, how do we work together to implement a stronger system? I would also say that I regret I'm not there personally, but I did note from your list of attendees that there was a very distinguished individual in attendance, and I hope she is there, Tracy Porteous, who's the executive director from BC of the Ending Violence Association. And if Tracy is there, I encourage you to have time to talk to her about what we're doing in British Columbia, the direction we're trying to go. And Tracy has been an enormous force to make sure that the issues around violence and family violence are kept at the forefront, and has often worked for long stretches of time with little support. So it was important in doing this report and bringing it forward that we work with those in the community sector, the policing sector, and of course in government. And a key part of this report that I'm going to talk about today was to talk about something that we sometimes forget about, which is what was the experience of these children who were murdered by their father. Now, Alan Schoenborn murdered these children. I use the word murder, I should say killed, because he was never found guilty of a murder. He was found not guilty of the charge of murder by reason of a mental disorder. And Mr. Schoenborn is now stabilized in terms of his mental health and has been detained in a psychiatric facility in British Columbia. Whether he will be released in the future is up to a review board to decide, but in any event, he is detained, and he has not been found guilty of a murder. So I use the word murder in the popular vernacular, not that he committed a murder as defined by the criminal code. but he killed and murdered his three children in 2008 in their home in the interior British Columbia. At the time of the murders, the three children, Caitlin, Max, and Corden, were 10 years old, 8 years old, and 5 years old. Our report looked at the lives of these children, really for the youngest child, the entire lifespan. For Caitlin, the 10-year-old, probably the 8 years of her life. What happened in that family over a period of time. And we do a deep analysis looking at the systems that may have been involved with the family, whether it be policing, child welfare, education, and other services or supports to see whether or not they understood the level of risk or harm the family was in, or how they may have mitigated or engaged with the family. But also as a child advocate, I wanted to give some understanding about the lives of these children. And so I'll start just there and leave this with you as we go then into deeper issues around risk and safety. The three children in the year prior to their murder moved from a community in the Lower Mainland into the interior of BC. In part, they were moved at the urging of child welfare officials that suggested they should move a distance away from their father because that would be probably a good plan for their safety. Ironically, they were encouraged to move to a community that didn't have effective domestic violence supports. Files were not transferred. The idea that moving away from a perpetrator, their father, would keep them safe, the geographical fix, I call it, was a very significant concept in the minds of the child protection side. However, it really didn't provide safety. It wasn't a risk management strategy. Sometimes relocation is a risk management strategy when it goes with other supports. But essentially, the children and their mom were encouraged to move to another community where they had no social supports to speak of except for a single relative who was not informed about the role that she would play to help them. They were financially destitute. They were isolated. Mom was dealing with severe issues just around the chaos that she had experienced. And the geographical fix ended up making them even more vulnerable than they were in their prior community. I say these things because we pretty carefully looked at the level of services and supports which were available in the Lower Mainland, namely the Greater Vancouver area, versus a small community in the interior. When the family arrived, the children went to a new school. They started school. There were many issues at the school involving their father because not only did they move, but their father moved them to this community under the full knowledge of the social workers, as when they went to check on the mom as she was moving, he was there moving them. So it wasn't really a safety fix. Mom was completely financially dependent on Mr. Schoenborn, who was a self-employed roofer. She had been staying at home with the children, and I think because of her very fragile emotional state, had been significantly challenged in terms of being able to care for herself, let alone manage even such thing as a move. So they moved to this community. They started in a new school. And a very interesting aspect of children who experience a significant depth and breadth of domestic violence over a period of time is, and many of those in the audience who have practiced in the area of child psychology will know this, they presented as unusually positive and sunny. In fact, at school, they were talked about as being, very joyful, making friends easily, being very positive, presenting as absolutely no difficulty whatsoever to anyone, not appearing withdrawn. All outward signs of the lives of these children was that they were happy, well-adjusted, normal children. Now, I'm not saying domestic violence deprives children of a positive outcome and disposition. However, it's also clear what we know about domestic violence in children is that they will often present in an overly sunny perspective as a way to protect their mother or father from scrutiny as to what is going on at home. And there is no question as we delved into the lives of these three children that they had, in particular the older daughter who was 10, They had been trained to develop strategies to protect their family from what they would probably, see as being intrusive or problematic, looking at what was happening in the home. Their young lives were characterized by chaotic and hectic moves, very unusual behavior on the part of their father, which stemmed from his persistent delusions that the children, in particular, starting with the firstborn daughter, Caitlin, that she was being sexually abused and groomed for the sex trade, to delusions that the father had that the mother was unfaithful, the father's drug use, alcohol use. And what we learned from the investigation, and actually after the murder, was that Mr. Schoenborn had a major psychiatric disorder, a serious, untreated mental disorder. What we also learned in the investigation was this serious, untreated mental disorder, which became fairly apparent to everyone in 2008 when the children were murdered, the nature of the murder, the way in which he killed the children and the purpose for which he said he killed the children, and his behavior leading up to that murder and just even the week prior. When we looked back, we found that in 1999, Mr. Schoenborn had driven at high speed in the Lower Mainland to a hospital with his young daughter, this time she was an infant, Caitlin, in a car seat in the back of the vehicle. On the way to the hospital, he caused 2 accidents. The vehicle was disabled. Eventually, they attended at the emergency room where Mr. Schoenborn was insisting that his child had been sexually abused and was being sexually exploited by his wife. They examined the daughter, the child, and they found no sign of injury, and there was no relationship between his ravings at the time and the condition of the child. His partner, their mother, attended at the hospital, took the child. He was very, very briefly held, like 24 hours, detained. It was suggested he had a major mental illness in 1999. He was released to follow up with some aftercare. He never engaged or did follow up with that aftercare. The last known contact he had with any therapeutic supports in the mental health system in British Columbia was in 1999, that incident at a hospital, up until after 2008, when they did a psychiatric assessment around his fitness and his capacity as part of the criminal proceedings. So a serious sub-issue, very serious sub-issue, not unlike some other major homicides that many in that room that you're in today will be familiar with, is untreated mental disorder, which is not to suggest that people with mental health issues are not good and capable parents and to stigmatize that, but adults that have a major mental illness that involves a delusionary aspect, particularly when the focus of the delusion is that the children are somehow being harmed, that the risk of injury, abuse goes up significantly. So parenting when there is an untreated mental disorder is a significant issue for those who work in child protection and policing and community safety. What is quite, I think, staggering about the Schoenborn case is that this family coped with their father's major mental illness virtually in isolation from everyone. He'd have periods of violence and aggression. Over the years, his spouse reported physical assaults, sexual assaults. There were assaults against strangers, assaults against colleagues in the workforce, assaults against his siblings. And throughout this, of course, there was a great deal of alienation and exclusion. However, he had periods where he was viewed by his spouse and his children to be a loving, providing, supportive parent. I think what's very interesting about this case was when we were investigating it and dealing particularly with Mom, it was the first time Mom really recognized that what had happened was that her spouse had a serious untreated mental disorder. She had thought perhaps it was his behavior was caused by addictions, using marijuana, taking alcohol. This caused these behaviors, so she wanted him to abstain from these. And the case also highlights a very significant challenge that we face when we do risk assessment safety planning, and that is batterers and their partners develop strong emotional attachments. In this instance, the mom had a strong positive attachment to dad and had a strong negative attachment to dad. So she was supportive of him being healthy and attempted to find ways to talk to people in the community about what could he do to function more effectively. She really received no support. She was the mental health system for him and obviously took on far too much responsibility. But let's come back to the lives of the children, because that's what I was very interested in. It was clear that in the lives of these children, particularly I'll speak about Caitlin, Caitlin's relationship with her mom became a friend relationship. Mom confided in her, looked to her for support. So you can see that the 10-year-old became essentially a young carer toward her mother, and I suspect toward her father and toward the family. The other siblings were clearly traumatized by what was going on. At one point during one of the child protection investigations, after which there was an allegation of a sexual assault and the house had been trashed by Mr. Schoenborn, the youngest child, when questioned by child welfare investigators about the circumstances, denied that he had a father, said he did not have a father, that they must be mistaken, there was no father in the family. Again, I think many of you in the room will know that's not an uncommon response to children who cannot cope with unreasonable, aggressive, and chaotic behavior by a family member, is to deny that they exist and disassociate. So the children had, over this period of time, in fact, over their entire childhoods, had to mediate the world of their dad's paranoia, chaotic behavior and delusions, their mother's trauma and response to this, including physical blows, emotional blows, and unsettling behavior. They had to mediate between that and the world at large. And I think there's something significant to learn from this case, as I believe there is from every case, about how children will present in a way that defies what's happening within the family. And I think it's important when we look about learning and training to think about how do we do risk assessment with family situations when there are children. What are the risks posed to children in these situations? And will children be reliable narrators of their situation? And how do we evaluate that? Of course, we also know quite well from the experience in domestic violence that partners, in this case, Mr. Schoenborn's partner of a significant period of time, was not very good at estimating the risk that she faced. However, she was very strong at saying that she couldn't cope with his chaotic, aggressive behavior, and she needed the intervention of police to control his behavior and others. Unfortunately, in British Columbia, the intervention of those support services in the child welfare system and the justice system were poor to non-existent in places and inadequate. So they were not able to provide the support. The ability of the income assistance system to be able to step in on an emergency basis and assist her to find some footing for stability to provide food, shelter, and a home for her children was not adequate. In fact, the government of British Columbia has had to look at this very carefully after this report, because although they said they had a policy, a discretionary policy to support women escaping violence, the fact is they placed this mom on a multiple week wait list. They said that they would not give her support because although her husband was a self-employed roofer, at one point he had listed her on his business, and they required her to go and file all of the income tax statements for a period of years because he was in arrears before they would give her social assistance. So not only did they say you won't get assistance, but they created a barrier that was so high that she was overwhelmed. And actually, you know, she's continuing to live with this terrible loss of her children, but certainly in our investigation speaks very strongly about just how bitter and depressing and overwhelming that refusal to support her in her moment of need with a pittance of financial support was, in terms of her circumstance. And in fact, when you look at the situation, how she survived that period without a complete mental breakdown herself, an incident of self-harm or what have you, it's quite difficult to understand, because the burden that she carried and the nightmare that she was living was quite amazing. In terms of the involvement with systems, so the last year before the children were killed, there were numerous domestic violence incidents, violent and confrontational incidents, but as well as they moved to this new community, a lack of communication. The Ministry for Children and Families, which is our child protection service in British Columbia, were not clear which community was serving them, who had primary responsibility for the file, following up. They referred the children from the Lower Mainland to the interior. They referred them to a Children Who Witness Violence program, which is a very important program. However, it didn't exist in the community, and the neighboring community that did offer it had more than a 1-year wait list. So it was not a practical, meaningful program. Furthermore, there is some significant controversy about whether or not children attending a Children Who Witness Violence program is an effective safety plan. Certainly as a child advocate, I don't think it's a good idea to say we're going to send the children to a program so that they can better understand the hell that's going on in their home every day. I think the better approach is to reduce and improve safety by removing that level of aggression and hostility from their day-to-day lives, and then engaging in the therapeutic process. So that was a very poor and meaningless response, because they never saw one session of any type of support for the enormous trauma that they had. There is significant ineffective case management, and matters escalated. And they escalated up to, say, the week prior to the children's deaths, in part because just as people thought there would be a geographic fix, send this mom and children somewhere else and we're going to fix the problem, which doesn't work very effectively in families like this. There was also the concept that nobody would speak to the father. So Mr. Schoenborn, the only individuals that really spoke to him were police during their episodic encounters with him in, say, the week prior to these murders. So at one point, just prior to the murders, Mr. Schoenborn attended at their school unannounced and insisted that he had to see them because he believed his daughter, again, Caitlin, his eldest daughter, was being bullied and possibly groomed for the sex trade. Again, a continuation of his delusionary thinking. He presented in an aggressive and hostile fashion at the school. The school principal, secretary, and others were overwhelmed. They didn't know what to do with this person. He started insisting and yelling that they call the police. So they did call the police. He wanted to talk to the police. They put them on the phone to the police, and the police did attend, and he was arrested. He also threatened another child who he felt was possibly the source of some of the bullying and sexual grooming of his daughter. Again, the risk that he posed, the safety risk that he posed at that school to other children and staff is quite staggering in hindsight. And I think even to this day, in my dealings with that school and that school staff, they continue to feel a strong chilling effect of this case, because a challenge we have in British Columbia that I spoke about in the report when I crafted the recommendations is people do not share court orders. There's not communication among systems. Children are in public school systems. There's a court order to provide for the safety, protection, or non-contact between them and a parent that may be aggressive, pending court proceedings, but the school doesn't know. Not to mention, they're not sure what to do if the person attends. So this did come to light in this case. So in the week prior, he's behaving this way. The police arrest him, and the police notes suggest, well, he seems fine. He's perfectly fine in our custody. So again, a befuddling response, because yes, he's fine because he has a delusion that his child is being sexually abused, but he may not have an issue with the police. So it's a very odd thing, but he's never engaged with. There are some significant issues around policing in this community as well, which I've since taken up with the RCMP and tried to promote some improvements and changes, which I hope will happen. But for instance, he was detained in the police cells. A senior child protection person from the local office wanted to come and talk to him about what was going on. The police refused them access to him, which is not appropriate. So really, Mr. Schoenborn, nobody told him what was going on with his children, with his situation. He had these multiple orders. At one point, there was a supervision order in the child protection system. At another point, there was a bail order for no contact. Another complexity is during the year prior and leading up to this intense week prior, he was in and out of custody and to the attention of authorities, and frequently released on a recognizance or cash bail in the last instance. His brother posted cash bail for him. But he didn't understand what was in his orders. And in fact, social workers didn't understand what was in his orders, and even the court that put in place his final order that he had when he left custody and then murdered the children didn't have all of his orders before them. And this is a major issue around information sharing and collaboration and identification of conditions. He also didn't have bail supervision, which we know is a very serious way to control the actions and interactions between a perpetrator of violence and a victim and children. Bail supervision is crucial, and I think many, again, in the room know that risk assessment is one side of the equation. Mitigating risk and safety, particularly because there's frequently in these higher risk cases a criminal aspect, requires meaningful bail supervision and consequences when there's breaches. And of course, I'm not going to forget that the other crucial part is support of the victim and understanding what the process involves and how they can keep themselves safe, but also begin a process toward more stability in their own lives. So in this week before the children were murdered, there were no fewer than 14 professionals, child welfare staff, police, and others involved with Mr. Schoenborn. He was presenting as someone who had some major delusions. He was disheveled, disorganized, chaotic, threatening, yet he was released from custody. The final bail hearing, when he was released from custody, I've referred to it in public, and I've had lots of discussions with the courts and the Minister of Justice in BC and others, but it's a bail hearing that I can only refer to as a gong show and a disgrace to the justice system. In the community that he was detained in the interior, they have a telephone bail system. They don't have an actual judge sitting in the community. A few years back, BC cut back its justice system and they used telebail. It's not a video conference like today where you see people, it's a telephone call. A judge in another community altogether heard the reasons for him to be detained or released. Instead of a Crown prosecutor presenting, it was a constable, a fairly junior constable, and with all respect to the constable, they're not trained to be Crown prosecutors. The constable in the local detachment represented the Crown, and then Mr. Schoenborn was there representing himself. It was unclear who was doing the speaking, but when the judge said, "Is there any issue with respect to harm to his partner?" the answer on the telephone was no. It was clear the judge thought it was a police officer speaking, and he was released. His record, the other orders that were in place were not shared. There was not a full search. There were some very serious flaws. He left custody, went to the local office of the Ministry for Children and Families, it was now a Friday afternoon, and said, "I want to know what my orders are because I want to see my children." And they said, "Well, we're kind of busy. It's Friday. Come back on Monday. We'll talk about it." He then murdered the children over the weekend. So there was no engagement with him, which also suggested some significant issues around safety. Identifying a parent with a major mental illness who's not connected to mental health supports is a really significant part of understanding what's happening in domestic violence and in potential for lethal homicide or potential for just chaotic behavior within that family. So the justice aspect and the child welfare aspect were suboptimal at best, and suggest that significant improvements needed to be made in British Columbia. So on the mental health issues in particular, I think it's important. I mean, I appreciate many of those in attendance at this conference have experience in a variety of provinces, perhaps stronger or different than British Columbia, but there isn't a seamless system of supports in the mental health system in British Columbia. And as many there will know, we deal with a very difficult issue, which is if an individual does not engage with treatment. So after 1999, when Mr. Schoenborn rushed by car to the hospital causing these accidents, he was discharged to follow up with a psychiatrist. He had one meeting. He didn't like the medication. It made him feel bad, and that was it. Some provinces, hopefully represented in the audience there, will have programs where you actually track, engage, and have an outreach to individuals with mental illness. Some provinces, fewer, have programs that outreach to parents with a mental illness. We have, because of the Charter of Rights and Freedoms, as you know, individuals have a right not to engage in treatment. They don't have to take their treatment. You can't force people to take medication. You can't force people to get treatment. That's a prevailing ethic. And since we've deinstitutionalized mental illness in Canada and put people out to the streets, they enjoy these human rights, and therefore they can, have a hectic, chaotic life and pose a safety risk. I mean, that's just the way it is, right? However, what about if they're parents? If you're a parent, your access to the child doesn't fall under that same concept. Child welfare and a stable and effective response to domestic violence requires us to carefully supervise what is happening in a family. That's a negative way to look at it. To more positively offer supports and systems where if you have a parent like Mr. Schoenborn with a major psychiatric illness characterized by periods of delusions, the hypothetical parent like that needs to stay connected to the mental health system. And if they're going into a period of significant delusions, changing medications, and people with major mental illnesses change medications because they have terrible side effects and it's not easy to have lifelong mental health supports, the family needs to be supported to say, listen, dad's off his medication, something's happening here. That kind of education and support also didn't happen in this family and doesn't happen routinely in British Columbia. The police are experienced in dealing with people with mental illness because they deal with them all the time. It's often the street homeless population that they engage with who has a major mental illness. They don't feel they can coerce them to take treatment because it's a basic issue. At the same time, the child welfare system is there, the family support system is there, and there's a massive gap. So British Columbia, I suspect, like some of the other provinces, have this. In the report, we spent quite a bit of time thinking about this issue because, again, when we do an investigation, we don't know what we're going to find. So we were quite surprised to find that 1999 incident where Mr. Schoenborn demonstrated a major mental illness and that he was completely disconnected. And we reviewed all the health records and interviewed people. He was disconnected during that entire period from health supports. So I think we looked at Australia in particular because in Australia they have a very significant national initiative on children of parents with a mental illness. It's a health promotion program. It's very positive. It's community-based. Someone who's a dental hygienist is trained to talk about mental health and parenting and so on. So it's been very destigmatized and supported. And part of it goes to this issue around, reducing hectic, chaotic behavior in families, supporting children who are sometimes put into position as being a young carer, as young Caitlin was for her mother and her father. And it also develops a number of programs to make the health system work more effectively with the education system, policing, and others. So it's one example. I just put it out there to say we really looked at, is there somewhere else in Canada that's doing that? And I may not be aware of something in some of your jurisdictions. I hope there's more. But Australia seemed to be quite good. And in fact, we brought some of the folks from Australia to British Columbia to talk to the senior officials in health and engage with them and talk about these issues. So it was extremely positive. We're not moving too quickly on building this, but we do have a commitment from government to look at how they deal with this. I want to make sure I have time for questions, but I want to just come down to recommendations. And again, I thank Dr. Jaffe. Dr. Jaffe was a consultant on this report. This is the second major domestic homicide case I've asked Dr. Jaffe to assist us on because of his role with the domestic violence panel, his academic experience, his commitment to improve service delivery and understanding in this area has been a very important assistant to us. The other report that he advised on was the homicide death of Christian Lee, who was murdered by his father, Peter Lee, who also murdered his mother and his grandparents in 2006, a few years prior. So when I did recommendations in this report, I had already published a major domestic violence homicide report out of the Christian Lee case that called upon the government to take some strong steps in British Columbia because some significant ground had been lost, to put it mildly, in British Columbia on domestic violence. Even though they're excellent people working in victim services, there was a few areas where there was integrated police community units. There's a few one-offs here and there, but there was no systemic work happening to the same level at the level it needed to happen. And there was a significant defunding of work in this area as well over a period of years. So I'd made recommendations in a prior report. When I made the recommendations in the Schoenborn report, sadly I had to say some things had been looked at, but really not seriously. And it was time to get much more serious about a system-wide, effective and responsive domestic violence approach, which is going to be monitored and reported on. The day the report was released, the government of BC announced that they were going to create a provincial office for domestic violence. I think that was a good sign, and I certainly offer my support to that initiative. Of course, it has to be a meaningful, realistic initiative. You will see in the report, and you can see it on my website as well as the previous report, which is the representative for children and youth for BC. All of our reports are there, as is some links to responses to the reports and recommendations. But I called upon the government to present a comprehensive domestic violence plan by September of this year. They actually presented a plan toward a plan just this past month in October of this year. And again, I give them credit because they had not done the type of work across the Ministry of Attorney General, the Ministry of Housing and Social Development, the Ministry for Children and Families, other impacted ministries. They hadn't done collaborative work for so long that it was hard to get out to a plan. They had to do a plan toward a plan. And so they've been starting to do that, still not adequate in my opinion, and there's no real money attached to it yet. But a significant initiative at training people in the frontline systems of child protection, policing, schools, and so on. So there's some good news coming out of the report, but there's a huge amount of work to be done. And, again, we look at the role of domestic violence in children's functioning and health and well-being. I'm soon to release a report on a significant cluster of suicide and self-harm deaths by adolescents in British Columbia. The youngest was 9. The youngest suicide was a 9-year-old up to 19. A lot of these are self-harm. It, again, was staggering to me in preparing that report, which I'll preview briefly. It'll be publicly released next month. The number of those children engaging in self-harm that had significant exposure to domestic violence, such that there were child welfare intakes. They were witnessing significant violence, injuries, in some instances murders of their mother, or suicides of a parent. So, the harm, the need to take a strong focus on the child, quite apart from the domestic violence homicides, is the suicide of a child living in a home where the frequency and dose of domestic violence has been characterized their entire 14 years of life. Is that a domestic violence death? I think it is, actually. I think we need to change how we understand trauma and impact on children. At the same time, children are resilient, and depending on the frequency and dose of exposure to domestic violence, have an opportunity to recover and do well with support. So the quality of supports mean a lot. But the situation today in British Columbia is that we have come to a better position of public acceptance of this issue. And as I said at the outset, people like Tracy Porteous, who have been working in this for years, have tried to keep the profile up, the need that you have to work in this area of domestic violence collaboration. It needs prominence in government, it needs long-term commitment, and you can't waver from that. I think it's fair to say in British Columbia they wavered from that significantly for a period of time. We're trying to rebuild it. We've lost some, opportunities. But I also come back by way of closing. I know that the final session on your conference is about national strategies. I do think it's important that we find as many opportunities to talk about national approaches to risk assessment, safety planning, and learning. While the reports that we do in British Columbia are being shared with others, and I read other reports, domestic violence homicides are not being investigated as sufficiently and thoroughly as they can be. And I certainly can't do all of them in British Columbia. Just last week, there was a sentencing in a second-degree murder plea to a domestic violence homicide of a young mother who was murdered by her spouse, whose body was decapitated and placed into a suitcase and placed in the Fraser River and later recovered by fishermen. And she left behind 2 young children. This again is a case that, well, someone has been sentenced for second-degree murder and so on, and there was a criminal sanction. Understanding, did we do everything we could have done to support that mother and those children is something that we have to take very serious as a public function. And we need to share those results across Canada and talk about it. And we need to ourselves in our provinces engage in collaborative forums with police, with child welfare, with education, with the victim services and community serving sector. The final point I'll make is a lot of the cases that I research and I work on and report on and I provide advocacy on involve Aboriginal children and youth. I haven't touched on the Aboriginal children and youth issue today, except to say from a national perspective, it's very confusing what will happen with protective orders on reserve. We have new federal legislation which has caused a significant amount of confusion about the duration of a protective order, how it will be obtained, and how it will be enforced. And I think there's some real public safety issues on that front that are not only in this province but are national issues. So I will leave it there, and subject to the direction of the chair, and if we have time, accept some questions. Thank you.
Thank you very much.